Hello everyone, welcome back. Today we're going to be learning about epilepsy. This is going to be the topics that we will cover. So epilepsy is a neurological condition where there is recurrent seizures. It's caused by abnormal electrical activity in the brain. Common symptoms include seizures, collapse, tongue biting, incontinence of urine where you can't hold the urine in, and a postictal phase where the patient may be drowsy, struggling to sleep, confused, irritable. The seizures usually last between 15 minutes, but can be longer. And the gold standard investigation is usually a EEG or an MRI. There are two classifications of epilepsy. They can be focal, also known as partial seizures or generalized seizures. Focal seizures are focused within a specific lobe or area of the brain. And they can either be with awareness or without or with impaired awareness. And generalized seizures are split into either absence, tonic-clonic, myoclonic, or atonic. The most common is tonic-clonic. So we'll go through the generalized seizures now. The first being tonic-clonic, which is typically what you think of in movies when you think of epilepsy. So it has a tonic phase and a clonic phase. The tonic phase is when the muscles start to tense or stiffen, and then you have the muscles starting to jerk or have convulsions. Usually lasts between 2 to 3 minutes. You can see Homer Simpson on the right basically demonstrating what a tonic-clonic seizure is. There may be a loss of consciousness and a postictal phase where they are confused, drowsy, irritable, or depressed. Now, common theme that you'll notice throughout the coming slides is that the most commonly used drug, especially if they're males, is sodium valproate. Just remember this. The most commonly used drug in a man is sodium valproate, and in a woman is lamotrigine and levetiracetam. With exceptions such as absence seizures and focal seizures, which we'll get into. But generally, this is the general treatment for anyone with epilepsy. And this is because lamotrigine and levetiracetam are really safe in pregnancy. They also can impact on male fertility, so we want to prefer it when with a female patient and avoid it with a male patient. And sodium valproate is generally the most commonly used epileptic drug. It's also teratogenic, so you don't want to give it in a woman of childbearing age. Absence seizures, also known as petit mal, is the most common in children. It can occur when there's the patient basically goes into a phase where they're just staring blankly into space. They've gone absent. It's kind of in the name. It can be triggered by things like stress or hyperventilation, and it's also on an EEG will show up as bilateral symmetrical 3 Hz spike, which you can see kind of as a picture on the right. And it's one of the exceptions to the treatment rule. So first line is ethosuximide, and then the second line is the same as tonic-clonic seizures. Atonic seizures, another type of generalized seizure, is basically drop attacks. So you'll have lapses in muscle tone where the muscles become very spastic and relaxed, low tone, and then there'll be a drop or a fall, which will usually last less than 3 minutes. And it's also associated with childhood and in patients with Lennox-Gastaut syndrome, which is just a syndrome which increases the risk of epilepsy in children. And the treatment is again in males sodium valproate and in females lamotrigine. Myoclonic, quite similar to tonic-clonic, is also really brief and uncontrollable jerks and twitches, but the difference is with myoclonic is you will be awake, so there will be no loss of consciousness, whereas in tonic-clonic you may lose unconsciousness. And again, very similar, it's a general pattern of epilepsy treatment, sodium valproate first line, especially if you're male, levetiracetam or lamotrigine for females. The exception being absence seizures, where the first line is ethosuximide, and focal seizures, which we'll get to next. Focal seizures, as like I said, is focalized within a specific subsection of the brain. So it can be within the frontal, the temporal, the parietal, the occipital. It can cause Todd's paralysis, which is essentially a paralysis in either all or some parts of the limbs. Jacksonian march, and this is all if it's within the frontal lobe. Jacksonian march is when there's twitching within a very small area and it spreads to a large area. And then differences in head movements. And basically the way I remember it is by remembering the function of each lobe and what would happen if you had a lesion in one of them. So the focal frontal nerve is designed for processing of movement, for posture, and also mood, and therefore you get these symptoms of postdoctoral weakness, head and leg movement, Jacksonian march, and Todd's paralysis. With the temporal lobe, it's usually function is usually memory, consciousness, and therefore a lesion here you'd get impaired consciousness, impaired awareness. They may experience deja vu, which is where they have a feeling that they're somewhere that's familiar when they've never been there, or jamais vu, when there's someone that's completely foreign and unfamiliar, but it feels like the surrounding is unfamiliar, but they have been there or witnessed something. Hallucinations and automations, lip smacking, dysphagia, plucking, and dysphagia. The parietal lobe usually is where sensation is processed, and therefore if there's a seizure, a focal seizure here, you're going to have paresthesia, so a loss and a tingling, loss of sensation in a part of a limb. And the occipital lobe is where visuospatial reasoning happens. So that means we'll have flashes, floaters, visual changes if a patient's got a focal seizure in the occipital lobe. And then first line treatment is going to be levetiracetam, or lamotrigine, and the second line drugs are carbamazepine, oxcarbazepine, and zonisamide. It's quite a lot to remember the various types of drugs and what's first line, what's second line, and what corresponds with what. The way I remember it is sodium valproate is the most common drug. You'll give it pretty much everything, especially if they're male, because it's contraindicated in females of childbearing age. Give it to the man. But the only and then second line is usually lamotrigine or levetiracetam. The only exception to that rule is absence seizures, where the first line is going to be ethosuximide. The way I remember it, there's 2 E's in absence, 1 E in ethosuximide, E equals E. And second line for that will be the gold standard, sodium valproate for males, levetiracetam or lamotrigine for females. And the other exception is focal seizures, where first line we want to give levetiracetam or lamotrigine. And always remember, sodium valproate is teratogenic, so you give your second line if that's contraindicated. So have a go at this question. The correct answer is C. This is clearly an absent seizure because they're staring blankly into space for 20 seconds, and the first line is ethosuximide. Okay, have a go at this. The answer is D. They have a focal seizure. This is because of the tingling, which starts in the fingers of the left hand and spreads up the arm to the left side of the face, so Jacksonian march. It's a focal seizure of the frontal lobe, Jacksonian march, and with focal seizures, the first line is levetiracetam or lamotrigine. It's D. So this patient has a generalized tonic-clonic seizure. Usually we'd give sodium valproate, but in a woman of childbearing age, that's a no-no. So we give the second line, which is lamotrigine or levetiracetam. So the answer is C. Just remember, lamotrigine and levetiracetam is favorable in women because it doesn't. It's generally quite safe in pregnancy, and we don't want to give it to men because it can reduce male fertility. And valproate, always remember, is teratogenic. Never give it in a woman of childbearing age. This table just summarizes the various drugs, the mechanism of action, and some of the common side effects. Basically learn this, especially the adverse reactions. So I would have asked you to guess, but the answer's kind of on the side. These are essentially the side effects of this drug valproate, the most commonly given anti-epileptic drug. The ones you want to pay close attention it's a P450 inhibitor. What this essentially means is that we have an enzyme called P450 enzyme, which is responsible for the metabolism of various drugs. P450 inhibitors can inhibit the P450 enzyme, and that basically decreases the activity and the metabolism of various drugs. And a P450 inducer is going to attach to the P450 enzyme and increase the metabolism and excretion of certain drugs. Valproate is an inhibitor. There's another drug called phenytoin, which is a inducer. And another big one you want to keep an eye out for is valproate is teratogenic. Like I said, phenytoin is a P450 inducer. So what that means is it attaches to P450 enzyme and increases the metabolism of certain drugs. So it can cause treatment failure of certain drugs. It can cause hirsutism, which is just black coarse hair growing where it shouldn't be, like in women, especially all over the face, arms, in just weird and strange abnormal places. It can lead to neuroscience, so nystagmus, which is essentially involuntary movements. And like most anti-epileptic drugs, phenytoin is also teratogenic. And the other big ones you want to keep an eye out for is interference with folic acid and peripheral neuropathy. This is kind of a silly mnemonic, but it helps you remember the drugs that cause Stevens-Johnson syndrome, which is essentially kind of like anaphylaxis, but it's caused by medications, which can lead to a red or purple skin rash with blisters, and it can affect the eyes, the mucous membranes, and cause your skin to shred. Really nasty, as you can see by the images. And the anti-epileptic drugs that can cause Stevens-Johnson syndrome include carbamazepine, ethosuximide, lamotrigine, rare but can still cause Stevens-Johnson syndrome. And the way I remember it is I imagine a boy band: Carl, Ethan, Larry, Stephen, and Johnson. If you know who this is actually take that, so the names don't correspond to the actual faces. But I just imagine a boy band, and the members are called Carl, Ethan, Larry, Stephen, Johnson, and that helps me remember carbamazepine, ethosuximide, lamotrigine leads to Stevens-Johnson syndrome. Pop quiz. So phenytoin is a P450 inducer, not an inhibitor. The drug valproate is, however, an inhibitor. And hirsutism, enlarged gums, ataxia, jaundice, these are all side effects of phenytoin. So the answer is topiramide. Just have a read of this. It basically shows the main side effects that each of the drugs causes. So phenytoin, ataxia, peripheral neuropathy, gingival hyperplasia, osteomalacia. Hirsutism, topiramide causes renal stones, That's where the question was kind of indicating. Carbamazepine, that's going to cause Stevens-Johnson syndrome, ataxia, dysarthria, nystagmus. Valproate, teratogenic in women of childbearing age. Always remember that. And lamotrigine, Stevens-Johnson syndrome, but very rarely. And in terms of the epilepsy driving rules, there's rules for cars and lorries and trucks. Remember the car one mainly. So if it's your first seizure, inform the DVLA. Your license will get taken away for 6 months. If you've had more than 2 seizures, so it's established epilepsy, inform DVLA. You can't drive for 12 months. However, the good news is you can get your license back. So if you've been seizure-free for more than 12 months, or you're on medication withdrawal for over 6 months, then you can apply to get your license back. So make sure to learn these. And below it's got the lorry rules, so you can have a look at that. So we can have a quick go at the prescribing task. Just make sure to get that link to have a go. I'll go through it now. So we've got a 6-7-year-old woman who's come in with shaking, tongue biting, urinary incontinence. And we've got her OBS. She's drowsy, disorientated. You're the F1 doctor. You examine her. She's unresponsive and her limbs are shaking. So please prescribe the correct medication to stop the seizure. Refer to the BNF, and we've got her information. So this lady has status epilepticus. It's basically the emergency form of epilepsy. Oh, I also forgot to mention, epilepsy isn't the only cause of seizures. There's also a lot of other causes. And we usually remember it with the mnemonic HIPSY. So H for hypoglycemia, I for infections, especially the HSV encephalitis. P stands for psychogenic, S for something, E for epilepsy, and A for alcohol withdrawal. And these are some of the other causes of epilepsy. Now, status epilepticus is like the emergency. It's like the bad version of epilepsy. So it's when your seizures lasted for more than 7 minutes. So in the question stem, we can see this patient has clearly had a seizure, but it's over 7 minutes, so she's got status epilepticus. Or if you've had more than 2 seizures in 5 minutes without it returning to normal, you've got status epilepticus. Now, it can be of any of the forms of epilepsy that we've discussed. The management guidelines for it is shown here. So firstly, you want to do your classic, A, B, C, D, E, get IV access, give them oxygen if they need to, monitor their OBS, ECGs, full blood count, EEG. Now, the first line treatment is if they've got IV access, is IV lorazepam 4 micrograms bolus. And if they don't, if they've got no IV access, buccal-midazolam 10 milligrams, mg. Sorry, I'm not sure if it's micrograms or milligrams, but mg, 10 mg. If that's not work, you go to your second line. So any of the following: IV levetiracetam, 60 micrograms. Max you can give is 500. IV phenytoin, 20 mg. IV valproate, 40 mg. And that should hopefully help. And obviously ongoing, do the monitoring as written down the side. And since this is a medical emergency and you're not giving it in regular amounts, it goes in the once only prescription. So that's how we would prescribe it. And always remember to do the drug allergy. That's one of the things I would do first, because they'll just, to pass a station, always make sure you have the drug allergies, sign it, and if they have a drug allergy, what reaction. And then you can fill out the patient details. And remember, lorazepam, because it's not something you give for an established diagnosis, it's really just a one-off for an emergency presentation. It goes in the once only. Now to summarize, epilepsy has 2 classifications: focal, also known as partial, that splits into aware or impaired awareness, and generalized, which is tonic-clonic, absence, atonic, myoclonic. Tonic-clonic, tonic means your muscles are stiffening, clonic means you're jerking. You got your loss of consciousness. Absence, common in children, you stare blankly into space. Atonic, these are drop attacks. You've lost muscle tone and then you drop. You fall to the floor. And myoclonic is kind of like tonic-clonic, so you get these brief, really uncontrollable jerks and twitches, but you're aware, you're awake, there's no loss of consciousness. And the way I remember what you use to treat what, because it's quite confusing, sodium valproate pretty much for everything, especially if they're male. Because it's teratogenic, you don't want to give it in a woman of childbearing age. And the second line, especially if they're female, is lamotrigine or levetiracetam, especially if they're female, because it's really safe in pregnancy and it's going to just mess up male fertility. So levetiracetam and lamotrigine, second line, especially if they're female. The only exceptions to this rule is absence seizures, give ethosuximide. Absence has 2 E's, ethosuximide is an E, and then the second line is the standard sodium valproate for a man, lamotrigine, levetiracetam for a female, and then the other exception is focal seizures, give levetiracetam and lamotrigine. Valproate is teratogenic, avoid it in pregnancy. And in terms of status epilepticus, A, B, C, D, E, IV lorazepam 4 micrograms if they've got IV access, buccal midazolam 10 mg if they don't. And in terms of the driving rules, first seizure, inform the DVLA, don't drive for 6 months. 2+ seizures, inform DVLA, no driving for 12 months. And if you've been seizure-free for more than 1 year or over 6 years alcohol withdrawal, you can apply to have your license back. So, final question. And the answer is 12 months. The minimum amount of time he must be seizure-free before he can get his license back is 12 months. Thank you so much. That was quite a detailed and extensive video, but I hope you learnt a lot because I certainly did. If you have any questions, please make sure to comment down in the comment section below. Thank you.